hope everyone can hear me clearly. Welcome to the 2022 CPD Masterclass. I just wanted to highlight a few things before we can start. Please take note if you are joining us on YouTube. This session will be approximately 2 hours. We encourage you to stay until the end so that you can get all the information firsthand. And the presentation will be made available on our website on www.sapc.za.org/pharmacist CPD. So after this session, the presentation will be made available. And for any queries that you might have after the presentation, you may either comment in the chat boxes, or you may also email us at pharmacistcpd@sapc.za.org. Thank you. By way of introduction, my name is Mokwadi Mohanu. I'm the Senior Manager in the CPD and Registrations Unit. We thank you for taking time out to join us for this session. I'm not alone today. I have other members of the team from the Office of the Registrar. I'm just going to quickly introduce them. Yes, we have Mr. Madimeja Mashishi, who's the manager in the communications stakeholder relations department at the South African Pharmacy Council. So they are the ones that are running the show in the background in terms of the streaming this session live. We also have Natalie Eben, also in the same department. We also have Neo Ramukoka and Nokutulam Simango, who are also in the same department. In the CPD and registration unit, we are also joined by Mr. Bansekolela, who's the manager in the department. So thank you for availing your time for this session so that it can be a success. So we'll now start with the presentation for today. We will not take too much of your time, as we do understand that you don't have that much time, but this is important for you in order to take notes so that you can comply with CPD requirements for 2022. So I'm just going to share my presentation. Right, I can't see my screen here. Let me just do this quickly. All right, I hope everyone can see my screen. All right, I've already introduced myself and we've already done the welcomes. I'm just going to go to the outline of my presentation. The outline is that we'll discuss the CPD requirements, we'll look at annual declaration and also designations of persons. We'll look at CPD essentials and look at competency standards for pharmacists. We'll look at the domains and competencies that are covered in the competency standards, and we'll also deal with frequently asked questions and facts. And then the next one will be how to learn. We'll look at what constitute a good CPD activity. We look at the different learning activities that are available for pharmacists to engage in order to record their CPD activities. We'll also look at the issue of evidence in relation to the CPD activities that have been submitted or that are submitted. We'll also look at the compliance and archives entries. We'll look at how a pharmacist can select a year of compliance for their CPD before they submit. And then we'll look at the CPD submission deadlines and also the highlights. I'm just going to ask Natalie to post the link to the survey, which will serve also as an attendance register. We ask you to complete that link because it will just provide us with more information on how we can improve the sessions in future, and it will also serve as an attendance register for tonight's session. So we encourage everyone to complete the link. We'll also continue to remind you as we go along with the presentation to complete that link. So Natalie, if you can just share the link for us. Thank you. All right, the next slide is on CPD requirements. I'm sure by now most of you know what are the CPD requirements. unless you are a new you were a community service pharmacist in the previous year, and maybe you are not. You are interning the previous year and you are not sure yet, but we'll take you through what are the requirements for CPD in order for you to comply. So these are the CPD compliance requirements. You first need to complete an online annual declaration by February each year. So the annual declaration is what you complete to tell us whether you participate in activities that relate to the scope of practice of a pharmacist. And it also gives us an indication of which sector you are working in and so forth. So it's just to provide counsel with information, right? So you are declaring whether you are a practicing pharmacist or not practicing for that year. So once you complete the annual declaration and you are designated as practicing based on the activities that you selected that you participate in, you would be required to record at least 6 CPD activities for that year. And you are required to also maintain an electronic portfolio of evidence. Currently, with the system, we do not require pharmacists to upload any evidence on the system, but we require them to upload, to save that portfolio of evidence on their computers. Should it be called upon by pharmacists, by the pharmacy council, a pharmacist would be required to produce and submit such evidence. All right. And then the pharmacists are also encouraged to submit at least one CPD entry every year. Every month, every second month. All right. And then we do not accept any manual CPD submissions. So pharmacists must complete their submission on our online platform and submit it on our online platform. And as I've already indicated, that we do not require evidence to be uploaded on the system currently, but we request and encourage pharmacists to secure the evidence or to save the evidence on their computer should it be called upon that the pharmacists are able to produce such evidence. Right. All right. In terms of the annual declaration, so the annual declaration, the list of activities that appear under the annual declaration are based on the competency standards for pharmacists, which were approved in February of 2018. Right. The competency standards are structured in the following headings. We have domains, which is a heading that covers a list of competencies that a pharmacist should be able to do based on the sector of practice. Right, so we have then competency standards, and then under the competency standards, we have behavioral statements that guide how the pharmacist should perform their function under that particular competency or competency standards. Right. And then you complete your annual declaration, as I already indicated, that you need to select the activities that are related to the scope of practice of pharmacist, whether you participate in those activities or not. Should you select that you participate in at least one of those activities or more, you will be designated as a practicing pharmacist. However, if you select that you do not participate in any of the activities that relate to the scope of practice of a pharmacist, you will be designated as non-practicing, right? And should you fail to designate yourself or to complete an annual declaration by the 1st of February each year, the office of the registrar will designate you, and the designation will then depend on your the previous year's designation. So if you were practicing in the previous year and you complied with CPD requirements, should you fail then to complete the annual declaration by the 1st of February, you would be auto-designated as a practicing pharmacist. However, should you have been a practicing pharmacist in the previous year, but failed to comply with CPD requirements in the previous year, you'd either be designated as non-practicing in the current year based on whether you have any sub-roles. Sub-roles meaning that if you are registered as an RP or responsible pharmacist or tutor, you would not be designated as non-practicing in terms of the CPD regulations. You would be referred to professional conduct for disciplinary actions to be instituted against you. So the designation, auto designation will depend on your previous designation and whether you complied with CPD requirements in the previous year, and also depends on whether you are a registered RP or tutor, right? So if you are registered RP or tutor, but you failed to comply with CPD requirements in the previous year, we would refer you to professional conduct for disciplinary action to be instituted against you, but you'll still be designated as a practicing pharmacist. Right.
I'm sorry, Mr. Mano. We're still seeing the slide on annual declaration.
Yes, I'm on annual declaration.
Oh, I heard you talking of designation. I'm sorry then.
Okay. Thank you. And then designation of persons. All right. According to Regulation 4.1 of the regulations relating to continuing professional development, a person may choose to be designated as either practicing or non-practicing. I've already explained the process to say that you complete an annual declaration. You select the activities that you participate in or you engage in your daily work or profession as a pharmacist. If you select that you do not participate in any of the activities, you'd be designated as non-practicing. However, if you select at least one of the activities that relate to the scope of practice of a pharmacist, you'll be designated as practicing. So in terms of the definitions, practicing means a registered person is currently providing one or more of the services or performing one or more of the acts pertaining to their scope of practice. And then for a non-practicing person, it means that the registered person is currently not providing one or more of the services or performing one or more of the acts that pertains to the scope of practice of a pharmacist. So those are the definitions as I've already explained them. Right, in terms of CPD essentials, you need to just take a few minutes to familiarize yourself with the competency framework, and you can also refer to the CPD guidance document. But I'll show you the competency standards after we discuss the next slide. All right, in terms of the terms to remember, these are terms that are used in the document that relates to the competency standards for pharmacists. You have a domain, which is as I said, is a cluster of competency standards. They form a domain. You also have competency standards. And then under the competency standards, you have a behavioral statement, which is how you should perform your function under how you should perform the activities that relate to this competency standard. So it prescribes how a pharmacist should behave in performing certain functions that relate to the scope of practice, in terms of the competency standards. All right. So how the competency standards are structured is that you would have the introduction to the domain, right? And it will show you how, and then you'll have how the domain applies to you. So it will give an explanation in terms of how the domain applies to you. You'll have the competencies that relate to that particular domain. And as I've already indicated that under the competencies, you have behavioral statements. So pharmacist behavioral statements or the competency standards are divided in three, right? You have an entry-level pharmacist, which is a pharmacist who has just completed their internship, and they do not have experience in a particular field of pharmacy. So those would be considered as entry level. So they have their own scope of practice, their own competencies and behavioral statements that they need to adhere to. You also have intermediate practice. Those are those pharmacists that have experience. They have more than 3 years experience in practice, right? They also have their different competency standards or behavioral statements which relate to the competency standards of a pharmacist. And then you have those that are in advanced practice that have more experience. So those are pharmacists that have more than 7 years experience in practice as well. All right, so in terms of the domains and competencies, we have the following domains. We've got public health. We've got safe and rational use of medicines and medical devices, supply of medicines and medical devices. We have also organization and management skills. We have a professional and personal practice. And the last one is education critical analysis and research. So we do have six domains. I'm just going to stop sharing this slide and just take you to the competency standard document for now, so that you can see what it looks like. All right, I hope the document is visible. So I'm just going to show you an example of domain 1. So that is what the document looks like. You can find it on our website. Yes.
Sorry, can you stop sharing and share again? It's black on my side.
It's black, all right. Can you see it now?
No, I still can't.
Right, let me try again. Can you see it now?
No, Makori, it's still black.
Okay, all right. All right, but anyway, we will direct you where to find the document. I think we can continue with the presentation since the document is not visible to everyone. All right, so here it is, at least it shows here. All right, domain 1 is just an example. So does this apply to me? So it explains what the domain is all about. For example, this one says the domain applies to all pharmacists whose practice includes promotion of health and wellness through the provision of healthcare information and education to the public and other members of the healthcare team. Right. So it will give you then also the introduction, and there it gives you the competencies. So if you look on the block or on the block on the right, there it says competencies, and it gives you the 6 different competencies. 1.1 is promotion of health and wellness. 1.2 is medicine information and so forth. It is clearly indicated there. And then if you, okay, let me just go back there. Right. And then it tells you that a person who has achieved these standards is able to demonstrate the following behavior. So those are behavioral statements there. At the bottom there, it says provide advice on health promotion, provide advice on disease prevention and control, provide advice on healthy lifestyle, and participate in public health campaigns. So this one has 4 behavioral statements, right? So if you can just familiarize yourself with the competency standards for pharmacists, they are available on our website. You will get more information on the contents of the competency standards. Right, these are some of the frequently asked questions that we receive at the office. Pharmacists not working in clinical settings tend to ask the following questions. For example, I only develop regulations. I'm a pharmacist, but not working directly with patients. I research drug interactions and drug usage. I train pharmacists and pharmacy support personnel. So how does CPD then apply to me? So all pharmacists are catered for in terms of their sector of practice or area of practice in terms of the competency standard. So if you familiarize yourself with the competency standard, you will see that all pharmacists are able to submit CPD activities in terms of based on the competency standards for pharmacists. So you just have to select the appropriate domain and select the appropriate competency standard and also the behavioral statements. So familiarize yourself, you'll see that all pharmacists are able to submit CPDs. So it's not only restricted to pharmacists working in clinical settings and so forth. So, like for example, myself, I work for the Pharmacy Council. We develop policies, we develop guidelines for the profession. I do have competencies standards that I can, write the CPD about. So any pharmacist in any sector is able to write or to complete CPD activities based on the competency standards for pharmacists. All right, so just some facts, as I've already indicated, that pharmacy practice is not restricted to the provision of direct clinical care only. All right, it includes working in a direct or non-clinical relationship with clients, administration, education. We do have pharmacists who are professors at universities who are providing education to students. They can also submit CPD activities. Research, advisory, or policy development roles, and others. Any other role that impact on the safe and effective delivery of services in the profession. Right? So it is your obligation to choose the CPD activity relevant to your scope of practice. However, you are not precluded from choosing any other types of CPD if this information is useful in your personal development. So, as I said, any pharmacist can choose or is catered for in terms of the CPD, in terms of the competency standards for pharmacists. You just have to select the right domain, the right competency standard, and you'll see the behaviors that align to your practice setting as a pharmacist. You may be asking yourself how to learn, right? CPD is continuing professional development. It's a cyclical activity. In terms of the definition, the process it says that the process by which a registered person maintain and enhance their competency throughout their professional career. Right. So it encompasses a range of activities, including continuing education and supplementary training. So you might be involved, maybe furthering your qualifications. You might be enrolled for a postgraduate qualification, or you might be engaged in a process to attain a supplementary training certificate. Maybe you've enrolled for an immunization and injection technique course, or you enrolled for a PCDT course, right? That is a form of CPD, all right? CPD enables a registered person to perform, to develop in their area of practice and demonstrate competence. So that is what CPD is all about. All right, in terms of the CPD submission process, I've already indicated that you need to submit at least 6 CPD entries, and there are 2 different cycles to pick from, right? So there's the 4-step cycle and the 2-step cycle. So the 4-step cycle is normally a cycle that you would select if you have planned to learn something. Maybe you've identified your own learning needs, you've identified gaps in knowledge, and you actively took an initiative to go and go and get the information that you need, or to get the skill that you might need. All right, and also requires prior planning. Sorry, man, I clicked. I pressed a button by mistake, so it muted me. Just wanted to go back there. And then we have also the it allows submission for once for all. I mean, allow submission once all 4 steps are completed, right? And then you have the 2-step cycle where the learning is unplanned. It might be that you've accompanied your friend to a CPD evening because maybe they are going to attend a CPD evening on diabetes, and you thought maybe you know everything about diabetes, everything that there is to know about diabetes. But you find that you learn new information that you didn't know about. So this is an unplanned process where you select to say, where it only involves 2 steps of the cycle, which is implementation and evaluation. So it's not an activity that you planned for, but you learn something out of it. It could be that your boss sent you somewhere to go to an evening or to a symposium or a conference. You didn't plan or you didn't know what you're going to learn out of that session, but you learned something. So you can select the two-step cycle and complete only the implementation and the evaluation step. So this one is limited to 3 CPD activities per year. So meaning that 50% of your CPD activities is the maximum that you can submit this two-step cycle. And then this one is instant learning. You didn't plan for it, and it follows no thought process, as I've already indicated. All right, as I've already indicated, you need not need to submit evidence. All right, that is the 4-step CPD cycle, which has the 4 steps, namely reflection, planning, implementation, and evaluation. Right? And then the 2-step CPD cycle has only evaluation and implementation. I mean, implementation and evaluation, as I've already indicated. Right. What constitutes a good CPD activity? Right. A good CPD activity should have a learning title. You must ensure that the title is appropriate and relevant to the domain that you have selected. And the learning gap, you must identify or you must indicate what gaps you intend to fill in your knowledge or skill. So what knowledge gaps do you seek to fill? And then the next one is learning method or activity. You must indicate to us the learning method or activity that you're going to follow to attain the skills or the knowledge that you require. And indicate whether this will be measurable, non-measurable, or structured. So if it's attending a CPD evening where you do not have to write an assessment at the end of the session, and it's just for a short period of time, let's say a maximum of 2 hours, that would be a non-measurable activity, right? And for those that are measurable, you write an assessment at the end of the session that you've attended. Those would be classified as measurable. And then for those that are structured, is if you are enrolled for a postgraduate qualification, it could be a postgraduate diploma or a master's qualification, where you are enrolled with an institution that trains you or equips you with knowledge that you'd require. That would be classified as structured. All right, and you should also have a learning outcome. So what you intend to learn, what you intend to achieve by engaging in this particular CPD activities. What have you learned, and how did this learning improve your skills and your practice as a pharmacist? So that is what constitutes a good CPD activity. Right, in terms of learning activities, CPD, it's a simple process. People make it out to be a very complex process. So you've got different learning activities which you can participate in and submit the CPD activity. First, you can engage in a self-study where you identify a gap in knowledge and you go and search the internet or seek information, read the Pharmaciae or read the compendium of law to fill the gaps in the knowledge that you might have. Those are just examples. Or you may do case studies, in the workplace and so forth, to discuss amongst your peers and learn something and capture it as a CPD activity on our system. Or you may attend a conference, right? So those are the simpler ways of attaining or being able to submit the activities that you may do in order to submit CPD activities on our platform. And number 2, you may attend or enroll for a short course, or you may review an article, or you may be an invited guest to speak at a conference or at a gathering where you impart knowledge or information to other attendees in that forum. So those are other activities that one can engage in that will assist you to record your CPD activities on our platform. And the number 3 is the diploma. Those are those structured learning things or activities that you may participate in. You may enroll for a diploma, postgraduate studies, and so forth. So, yeah, those are the learning activities that are associated with measurable, non-measurable, and also structured learning. All right, in terms of the portfolio of evidence, I've already indicated that we do not require evidence, but we need to equip you with the knowledge so that you know in future when we require evidence, what the evidence should contain or what the evidence should cover, right? So in terms of your evidence should be current, meaning that it should be in the current year. So you can't submit evidence on a CPD that you've done in the previous years. It has to be on the current year. So the current year would be 2022 in this instance. Your evidence should be valid. It should be relevant, right? So to the domain and the competency standards. And also, as I've already indicated, it should not be uploaded onto the system as well. All right, this is just further explanation. Current, it says the CPD entry must relate to the learning during the current year, as I've already indicated. Evidence can be any document acquired in the learning process, and we do not require you to upload the evidence on the CPD system currently. All right, we have updated our system so that it's much easier to navigate, and it's easier for pharmacists to be able to view the CPD activities that they've submitted. So this is the old page that we had in the past. You can see here, it will give you the year of CPD compliance there. It will also give you the role, the status, whether the person is practicing or non-practicing. And it gave you all entries. It will just say 10 entries. But you couldn't view when you submitted the entries and so forth, what the entries were all about. So we've changed the system so that it's easier for pharmacists to be able to view the CPD submissions or the entries that they have submitted. Right. So this is the old page. So I'm not going to dwell too much on it. And then this is the new page, right? So the new page we've added. We've also added the total number of entries there, and you are able to click on the view entries. If you see there on the orange arrow facing down, there's a tab there that says view entries. So you're able to view the entries. And yeah, so it will give you the totals. It will give you the different years of compliance. In this instance, it starts from 2020 to 2022. And yeah, and at any time as well, you are able to update your annual declaration because we need the latest information to be submitted to council throughout the year. Should you change a sector, for instance, for example, let's say at the beginning of the year you were working in an institutional pharmacy or hospital, and you suddenly got a job in a community pharmacy, you are able to go and update the annual declaration there. By clicking on Update Annual Declaration. So this is what the new page looks like. And once you click on that tab, View Entries, this is what you will see, right? So we've also added the entry numbers so that you're not confused. In the past one or in the previous, before we made changes, you couldn't see the entry number, so you had to count manually. So in this instance, we've added the entry number so that you can see the number of entries you've submitted at any point in time. We've also included the domain so that you can see the domain that you've selected, the competency standard that you've selected, and also the competency. I mean the CPD entry learning title that you've captured or recorded with us. All right, it will also give you a status, whether it's archived or submitted for compliance or so forth. And then it is arranged based on the submission dates. The first submission date will be at the top, and then the latest submission date will be at the bottom, and the first submission date will be at the top, and the latest submission date will be at the bottom. So you'll be able to see all your submission. The CPDs that have been submitted, and also their submission dates there. So that's what we're doing. We continuously improve the CPD page so that we enhance the user experience by pharmacists. All right, we've also added a tab there where you select the year of compliance, because in the past, pharmacists could not select for which year they were submitting CPD activities for. So once you complete or you submit a CPD activity, it will be recorded under the current year. So we've now improved the system so that you can select the year of compliance there. So for instance, if you had activities outstanding in 2022, if you, for example, submitted 4 CPD, in 2021, you submitted 4 CPD activities in 2021, and you still have 2 CPD activities or entries outstanding, you're able to select 2021 and click on submit, and those CPD activities will be recorded under the 2021 CPD compliance year, right? So that is the new page. That's what it looks like. All right, CPD submission deadlines. For 2021, the submission deadline has passed. The grace period for 2021 ended on the 31st of May 2022. However, this was a concession that was granted by council as we had system issues towards the official end of the grace period at the end of April. So council extended the grace period by a month. Hence, you see there the 31st of May 2022 as the grace period end date, right? So after this grace period, the grace period ended, we did send pharmacists that complied with CPD requirements letters and certificates of compliance, and we also thanked them for complying with these requirements in the letters that we sent out to them. All right, and then those that failed to comply were designated as non-practicing. Those provided that they were not registered as RPs and tutors, because RPs and tutors are not, we are not permitted to designate them as non-practicing in terms of the CPD legislation or regulations relating to continuing professional development. So RPs and tutors that failed to comply with 2021 CPD requirements were referred to professional conduct for disciplinary action to be instituted against them, right? And then in terms of 2022 CPD compliance year, we do encourage pharmacists to submit at least one CPD entry every 2 months, right? And in terms of the submission deadline for 2022, it is the 31st of December 2022. So we are only left with a few weeks before the submission deadline arrives. So we encourage all pharmacists to submit their CPD activities by the 31st of December 2022. You might decide to wait for the grace period, but you never know what might happen during the grace period. It might be, that life events happen and you can't submit your CPD activities and so forth. Should you fail to submit your CPD activities by the 30th of April, we would not, if you had not submitted a single CPD activity by the 31st of December this year, and you leave it for the last minute and you fail to submit by the 30th of April, and something happens that you can't submit, it will be difficult to convince the CPD committee to give you a concession or to grant you a deferment from compliance with CPD requirements based on our recommendation that you need to submit, our recommendation to encourage you to submit at least one CPD every 2 months. So we encourage pharmacists to comply with CPD requirements by the 31st of December each year, right? And pharmacists that comply with CPD activities before the grace period, before the submission deadline, going forward, we'll be issuing them with CPD compliance certificates and letters. So pharmacists do not need to wait anymore until after the grace period to receive those CPD compliance certificates and letters. So, for example, in 2023, should you submit all your 6 CPD activities by April, we'll issue you all the CPD compliance certificate and letter and certificate by the end of April. So we do encourage pharmacists to submit their CPD on time and comply early. All right, just some highlights regarding our CPD system. We do not subscribe, or our system is not based on CPD points. All right, currently also there's no assessment for competence, so we only focus on compliance, but there is a plan to have the CPD for pharmacists assessed in the future, but not yet now, right? And we do not accept any third-party entries, so please do not share your login details with any person for them to submit CPD activities for you, because that is an offense in terms of the act, and disciplinary actions will be instituted against you should you share any information with your colleague or any other third party to submit CPDs on your behalf. All right, and we also, there should be no non-practicing pharmacists in the pharmacy. So we do have our inspectors that are out there in the field that inspect pharmacies. Should you be found to be non-practicing non-practicing pharmacist and working in a pharmacy, disciplinary action will be taken against you. So you'd rather apply to have your designation changed to practicing before you can continue practicing the scope of practice of a pharmacist. We do have a process where you can apply. We do have application forms should you wish to change your designation back to practicing, if you were you designated yourself as non-practicing, or we designated you as non-practicing due to your failure to comply with CPD requirements. All right, as a profession, as the South African Pharmacy Council, we encourage lifelong learning because we believe pharmacists need to keep abreast with the latest developments within their profession in order to stay and remain relevant, and in order to provide sustainable quality pharmaceutical services to all the citizens of the country. So that is just the highlights. Right, in terms of the registration app, we have developed a registration app, so you can download it via the Google Play Store or Apple iStore. It's the SAPC registration app. And also the Huawei store, you can also upload it there. All right, so we no longer issue the registration card, the physical registration card. So by virtue of your registration status as active and also your designation as practicing, you'll be able to see your cards. We call it a digital registration card on the app itself, right? Right. Currently, we do not have a functionality to upload the picture on the app, but we will work on that in the next year. So, should you want to change your photo, you can do that on the website. All right. You can also amend your personal details like your physical address and your post box, your telephone number. So we do encourage pharmacists to constantly update their personal details should it have changed, because Pharmacy Council communicates with you through your email and also your telephone number or cell phone number by sending out SMSs and so forth. So if your information is outdated, you will not receive any communication which might be important for you to have on your email or your cell phone number, right? All right, you are also able to capture or record your CPD entries on the SAPC registration app, so you don't have to wait, to capture your CPD activities later after you've attended the CPD evening or you've attended training and so forth. You can do it right on the spot. Just access the app and record your CPD activities on the app. So we've made life simple so that you can just record your CPD activities on the move. All right, that is the end of my presentation. I will take any questions. Remember to complete the survey, and also that will also serve as your attendance register. So I'll take questions. Natalie, do you have questions on the platform?
Makori, yes, we do. It says no evidence to be uploaded. Is that for both types?
Yes, it's for both types. We do not require evidence to be uploaded on any CPD cycle, whether it's a 2-step or the 4-step at the moment, right, for pharmacists. But in future, we will notify pharmacists when this evidence will become compulsory, if it needs to be uploaded or not. Thank you.
I have been compliant for 2020 and 2021. However, the platform is very complicated. One is not able to view the complete submission of previous submissions. Has this changed?
No, this has not changed. Remember, the submissions get archived at the end of each year, so that the system, so that we create space for new submissions to be recorded. So if you'd want to have a record of what you've submitted, I think you can submit on you can capture it on a Word document for yourself, and then just copy and paste on our system, and then keep that Word document for yourself to use in future if you'd like to have a record of what you've submitted. However, for us, we'll only show you the title of the CPD activities or entry that you've submitted for now. Thank you.
Thanks, Makwadi. There are no further questions at this point in time. If we'll just give the attendees a minute or two. While people are typing in the questions, we will share the survey link again and ask that all attendees please complete the survey, as it does form the attendance register for this evening.
Thank you. If you can just complete that. So if you, please make sure that you comply by the 31st of December. Should you struggle, we are here to help you. You may email us at pharmaciestcpd at sapc.za.org, and we'll be able to assist you there. And you
While we wait for attendees to enter their questions, just a reminder that there are helpful short tutorials on how to enter CPDs on our YouTube channel. You can also contact us on social media. Our handle is @officialsapc.
Natalie, any more questions?
Nothing at this point, Makwadi. I think let's just give it one more minute.
All right, there are no more questions. We haven't received any more questions. In that case, I would like then to close the session and wish everyone all the best with the submission of CPD activities. We hope that you submit by the 31st of December this year. And I would also like to wish you all the best for the holidays. Be safe until we speak again or meet again. Have a lovely evening. I pronounce the session closed or ended.
Makoti, quickly,
sure.
Just before you do, there is one question from YouTube. I'm just waiting for my colleagues to share it with me. Just give us a sec.
All right.
Makoti, the question is, will you please brief about reviewing, self-review or peer review? And can we submit more than one CPD for the same domain?
All right. In terms of self-review, if you want to assess yourself at a later time, you can do that. You can submit the CPD activity for self-review, but most pharmacists do not select that particular one. They select peer review. So peer review, we encourage pharmacists to speak to their peers before they nominate them or enter their P number on the system to be the persons who would assess their CPD activities. The peer would receive a notification that you've submitted their CPD activity to them, and they would be able to access your CPD activities for review based using the criteria that they would have access to perform that particular review. So once you submitted your CPD activity for peer review, it is automatically submitted for compliance, because we do note or acknowledge that some peers might not necessarily review you or review a submission on time, and it might be that your submission is reviewed after the submission deadline. So what we've done is that we've made the system submit your CPD activity for compliance at the same time it is submitted to the peer. So even if the peer does not review your CPD activity, you don't have to worry, it is submitted for compliance. Right? So those are the differences. So peer review, you can submit for peer review. You're able to access the CPD activity again. There's also an assessment criteria that you'll be able to see or view that you can assess your own CPD activity for now. And that's self-review, and then peer review is the same thing. The difference is that with peer review, the CPD activity is submitted to council at the same time as it is submitted to your peer, so that you are not disadvantaged if your peer does not do the review of your CPD activity. I hope that answers the question. Thank you.
Makwadi, there was a second part. Can we submit more than one CPD for the same domain?
Oh, yes, you may submit more than one CPD for the same domain. We do acknowledge that not all pharmacists engage or participate in competencies that are, spread out in all the domains. So, for example, you might be in manufacturing and some of the domains might not be applicable to you. So you may submit more than one. You can actually submit all the 6 CPD activity from one domain. It's up to you, as long as they are different and what you are learning is different. Your learning topics are different and so forth. So you may select the same domain for all your activities. Thank you.
Okay, that's the end of our session. Just a reminder that if anyone has any queries following on from the session, they can send us an email, pharmacistcpd@sapc.za.org.
Thank you, Natalie. Have a good night, everyone, and be safe this festive season. And all the best for the next year. Thank you, and goodbye.